Welcome to Breast Cancer Breakthroughs. Triple-negative breast cancer, or TNBC, is one area where we desperately need to make more progress for patients. TNBC is a very aggressive cancer, and one of the reasons it's so aggressive is that we don't have good ways to target this cancer to treat it. When TNBC becomes metastatic or spreads throughout the body, it becomes even more difficult to treat these patients. TNBC patients need more and better options. Today, we're going to talk about some of the big headlines in TNBC research and do a deep dive on some exciting progress that's being made to offer more targeted therapy options for TNBC patients. If you're interested in any of the references that we cite or want to learn more about TNBC, check out the links in our description for more information. Our first headline today is the chemotherapy shortage. Many of us think of chemotherapy when we think about cancer treatments, and breast cancer is no different. For TNBC patients in particular, chemotherapy is a critical component of their treatment regimens because we have so few targeted therapies that work for people with TNBC. Two chemotherapy drugs called carboplatin and cisplatin are currently being impacted by this shortage. These drugs are often given as the second-line treatments, or drugs that are offered after the first round stops working. This shortage is being caused by manufacturing problems overseas, where most of these drugs are made, and this may go on to impact some breast cancer patients. For those who are affected, oncologists are working with patients to ensure that they can receive the care that they need. Komen Center for Public Policy is currently engaging with lawmakers and other advocacy organizations to find a solution to this problem. This is an ongoing situation, and we will continue to update our community on chemotherapy shortages. We've linked an article below in the description for more information. For our next headline, there has been some good news in the world of chemotherapy. Capecitabine is a chemotherapy drug used as a first-line therapy for TNBC. The X77 trial, which was recently presented at the 2023 American Society for Clinical Oncology meeting, or ASCO, tested a new capecitabine regimen for patients. Researchers found that taking capecitabine for 7 days on and 7 days off, compared to the standard of 14 days on and 7 days off, resulted in fewer patients discontinuing their treatment and fewer severe side effects. This is a huge win for patients because having maximum quality of life while you're undergoing treatment is absolutely critical for people being able to complete their treatments. If you are interested in more of the research that was presented at ASCO, check out our last episode for more information. And now for our featured topic. As we mentioned earlier, TNBC is an aggressive form of breast cancer, and patients with TNBC face some of the worst prognoses. One reason why TNBC patients face these poor outcomes is because we lack good targeted therapies that can target and treat their cancer. We caught up with world-renowned expert in TNBC and Komen Scientific Advisory Board member, Dr. Lisa Carey, to discuss some of the treatment options that are available for metastatic TNBC patients, and we got her perspective on what the biggest unmet needs are for patients with TNBC.
The targeted landscape for triple-negative breast cancer that's metastatic falls in just a few categories. I mean, the first is that if patients have germline BRCA1 or 2 mutations, and germline BRCA1 mutation carriers are prone to getting triple-negative breast cancer, we have the PARP inhibitors. I mean, they work regardless of what kind of cancer you get, and they work if it's hormone receptor positive, HER2 negative. But this is particularly relevant for triple-negative because BRCA1 is the most common germline susceptibility aberration. It looks like it's also relevant for somatically acquired BRCA1 or 2 mutations. So the same drugs seem to work whether you inherited the abnormality or whether the cancer developed it. So I would put PARP inhibitors in a nice category for that. After that, in terms of targeted therapy, it's really, chemotherapy given in a more targeted fashion, which is the antibody drug conjugates. And there's a number of them either available or in testing. And there's immunotherapy, which isn't tumor targeted therapy, it's immune cell targeted therapy, but I think that counts. And those are added, of course, to chemotherapy. Again, typically in the first line setting, and in the PD-L1 positive is relevant for metastatic disease. The biggest unmet needs for metastatic triple negative breast cancer is that, in spite of a number of really quite impressive advances, we are still heavily dependent on chemotherapy or chemotherapy-based approaches. And we really don't have good targeted treatments. The second is that while immunotherapy has certainly changed the landscape and it's now routinely incorporated in early triple negative breast cancer, it still looks like it has a relatively limited role to play in the metastatic setting, only in PD-L1 positive tumors, only in the first line setting, only added to chemotherapy. And so I think that's another huge unmet need.
There is still so much work to do, but we also know that there is really exciting progress being made by researchers for TNBC patients. We also asked Dr. Carey about some of the new advancements on the horizon for patients with metastatic TNBC.
There are quite a few. I mean, this is a huge area of research, and there's a lot of exciting drugs out there. I think among the ones that are likely to report in the not too distant future are the Capitello 290 trial, which is a phase 3 trial building on the PACT2 phase 2 trial with the AKT inhibitor capivasertib added to Taxol or paclitaxel in the first line setting. So that drug added to fulvestrant in pretreated hormone receptor positive HER2 negative disease was already reported as positive a year or so ago. We're still waiting for the triple negative trial that I think has been close to accrual for about a year and a half now. So we're anxiously awaiting that. There's another in the in sort of the novel therapy approaches. There's a drug called trilaciclib, which is actually a CDK4/6 inhibitor, originally designed in a phase 2 trial to try and be a myelosuppressing. It's designed to prevent myelosuppression. But in the trial where it was given, with gemcitabine and carboplatin, or actually before, it didn't seem to do a lot for myelosuppression, but it did improve survival. So, which is unusual because, of course, we use these drugs typically in not in triple negative disease. So there's a phase 3 trial that called Preserve 2 that should be reporting also in the not too distant future. That's in first line and second line after immune checkpoint inhibition. There is sacituzumab. There's a variety of ASCENT trials, but the one that's probably going to be reported soonest is the ASCENT-03 trial, which takes sacituzumab govitecan, which is an antibody drug conjugate with a TROP2 target and a TOPO1 inhibitor payload. We use it in the later line setting now. Based on the original ASCENT trial. This is now ASCENT-03 is moving it into first line against treatment of physician's choice, which is the doublet of gemcitabine carbo or a taxane. So seeing whether sacituzumab works even better in the beginning rather than waiting till the pretreated setting is coming. And then finally, the TROPION-Breast02 trial, which is an antibody drug conjugate we don't have available yet, datopotamab, or Dato-DXd in the first line setting, PD-L1 negative tumors of Dato-DXd versus, again, a variety of chemotherapy options, including taxanes, carboplatin, et cetera. That should be coming out too, also.
The first line of treatment for metastatic TNBC is either chemotherapy or chemotherapy combined with immunotherapy if a patient's tumor is positive for a protein called PD-L1. Only 40% of patients are eligible for immunotherapy, however, which means that chemotherapy is the only option available for the other 60% of TNBC patients. One trial that Dr. Carey mentioned, the TROPION-Breast02 trial, has the potential to bring a new first-line therapy option for those who have metastatic TNBC and are not eligible for immunotherapy. We sat down with one of the principal investigators on the study, Dr. Tiffany Traina, to learn more about this new drug and this new potential option for patients.
Dato-DXd is short for datopotamab deruxtecan, and this is an antibody drug conjugate. So antibody drug conjugates are engineered drugs where there is an antibody that recognizes a specific protein on the surface of the cancer cell. And the back of that antibody has a little bit of chemotherapy attached to it. So Dato-DXd has an antibody that is targeting a protein called TROP2, and TROP2 is highly expressed on the surface of triple-negative breast cancer cells. When the drug attaches to the cancer cell, the chemotherapy attached to it is sort of internalized and delivered directly to the cancer cell. We've known in the past that antibody drug conjugates are highly effective in treating breast cancer, and other TROP2 targeting antibody drug conjugates have been successful. So we're really excited about this particular agent and study. I'm excited about this particular trial for several reasons. So first, triple-negative breast cancers have been challenging to treat. We know that for women in the first-line setting, while we're very excited about immunotherapy, unfortunately, the use of immunotherapy only applies to those patients who have tumors that are PD-L1 positive, and that's less than half of women with first-line metastatic triple-negative breast cancer. So this particular trial applies for those women in the first-line setting of metastatic triple-negative breast cancer who are not candidates for immunotherapy, and that's about 60% of women in the first-line setting. There are some really exciting data of this agent in early phase 1 studies, where in a heavily pretreated setting, response rates to this antibody drug conjugate are more than 30%. And if you look at women receiving this drug who had not seen anything like it before, response rates were over 50%. I think the other thing that's really exciting is you do not need to have expression of a particular biomarker to be a candidate for the study. And also, so far, what we've seen is the drug is very well tolerated. So there is the potential for some mouth sores, and yet that is something that we are really good in oncology at being able to help prevent and manage. There has been some mild nausea and mild fatigue, and about 30 to 35% of patients will have some degree of hair thinning. But in general, it's been very well tolerated with a great signal of efficacy so far.
To learn more about TROP2, the target of the Dato-DXd drug, check out our video linked below. Dr. Trina also gave us some insight into how this trial works and why she is excited about what this trial might hold for patients.
So TROPION-Breast02 is a randomized phase 3 trial, and this study will recruit about 600 women from around the world. The study will randomize patients to either receive Dato-DXd or treatment of physician's choice chemotherapy, which has some parameters around it of very reasonable standard of care chemotherapy agents like platinums and taxanes. The goal of the trial is to assess how well Dato-DXd works against breast cancer and compare that to our other available traditional chemotherapy options. And of course, we'll also be looking to see how the drug will delay time to progression and what its impact may be on overall survival. I think I'm always excited to find new opportunities for our patients with triple-negative breast cancer. This particular trial is exciting given the wide number of patients it could apply to. Also, as I said, we're seeing a signal of benefit and efficacy and a well-tolerated regimen. So I'm hopeful and optimistic that we'll see nice results.
Thank you again to Dr. Carey and Dr. Trina for their insightful expert opinions on the unmet needs and news on the horizon for TNBC patients. Dato-DXd is not currently FDA approved, but we'll keep you updated on the progress of this trial in a future episode of Breast Cancer Breakthroughs. Thank you all so much for watching. Here at Komen, we are committed to bringing you evidence-based information to empower you as you navigate your journey with breast cancer. Don't forget to sign up for reminders for Breast Cancer Breakthroughs. We've linked the homepage below. Our About Breast Cancer site is full of evidence-based information about breast cancer, including TNBC. If you're interested in participating in a clinical trial, we've linked a tool that can help you choose a clinical trial that's right for you. And finally, if you enjoyed today's episode, please take 2 minutes to fill out our short survey, which is linked in the description below. Thank you, and we'll see you next time.